Hello, my name is James Gibson, and today I will be giving you a brief presentation on hypertension and how we select the drugs to which we provide treatment. Hypertension, or high blood pressure, is measured by a blood pressure cuff and is defined when your systolic number or the top number is over 130 and the bottom number or the diastolic number is over 80. Stage 1 hypertension is defined as 130 through 139 millimeters of mercury or 80 through 89 millimeters of mercury for the bottom. And stage 2 is defined as over 140 millimeters of mercury at the top number and over 90 millimeters of mercury at the bottom number. So down here is a small illustration of the blood vessels and what happens when the blood goes through and the pressure is too much on the walls. It can cause damage which could lead to heart attack, stroke, and other cardiovascular disease. Here are some risk factors that include smoking, drinking alcohol, obesity, diabetes, chronic kidney disease, and age are things that can lead to high blood pressure. And here are some lifestyle changes such as a low sodium diet, 30 minutes of activity 5 times a week, and to stop smoking and limit alcohol, which can help to lower your blood pressure and help prevent you from having these heart attacks, strokes, and other cardiovascular disease that are associated with high blood pressure. Back to the illustration, as you can see, the endothelial cells, which line the blood vessel walls, from the pressure of the blood can cause damage. They can rupture, which can lead to stroke and heart attack, aneurysms in the brain, and these are all things that you do not want. So it's a good idea to keep your blood pressure low if possible. In the next slide, I'll have a concept map that shows how we decide which blood pressure medication you are supposed to be on based upon where you are with your blood pressure. So if you are over the limit, which is 130 over 80 millimeters of mercury, we will first recheck you again later after you're calm to see if you're elevated. If not, great. If you're still elevated, then we will schedule a follow-up within 2 weeks to confirm hypertension. If at that time your blood pressure is still elevated, then it is confirmed that you have hypertension and treatment should begin. So then we need to make a decision if you are of African American descent or not. If the patient is of African American descent, you begin thiazide therapy with a calcium channel blocker. If the patient is not of African American descent, you then decide between if the patient has diabetes and or chronic kidney disease. If the patient has diabetes without chronic kidney disease, the blood pressure goal is 140 over 90 millimeters of mercury, and you should start at ACI or in an ARB or an ARB. If the chronic kidney disease with or without diabetes, the blood pressure goal is the same, but you want to start the ACE inhibitor in the ARB or ARB along with another class of antihypertensive such as a thiazide or a calcium channel blocker. In this last slide, we will be going over antihypertensive drugs. So first I have the ACE inhibitors, which I was just talking about. Example is lisinopril or Zestril. They inhibit angiotensin converting enzyme, which reduces angiotensin II production. Next, I have the ARB, losartan or Cozar, which blocks angiotensin II activity, which is how they get their name. ARB stands for angiotensin II receptor blockers. So they block the receptor that angiotensin II binds to and therefore can lower blood pressure. Next, we have diuretics, which are broken down into two classes. Thiazide, such as hydrochlorothiazide, which remove sodium and water from kidneys through the distal convoluted tubule. And loop diuretics, such as furosemide or Lasix, which remove sodium and water by the kidneys by the way of the loop of Henle. Lastly, we have CCBs, which are calcium channel blockers. These are broken down into two classes: dihydropyridines, such as amlodipine, which is Norvasc, and non-dihydropyridines, such as diltiazem, which is Thiazac. They inhibit calcium channels and vascular, smooth muscle, and cardiac muscle myocytes, which help to lower blood pressure. And then beta blockers, such as metoprolol or Lopressor, which bind beta androgen receptors in cardiac tissue and contracting myocytes, which inhibits norepinephrine and epinephrine binding, which also contribute to lowering blood pressure.